Everyone, thanks for joining us, whether you're here or remote. We really appreciate it. We'll have a program followed by questions. To ask questions, if you're here in person, please go to the mic. And to ask questions remotely, please raise your hand in Zoom and we'll call on you. We do have a hard stop at 1 o'clock. Thank you.
Good day, ladies and gentlemen. Thank you for being with us today. I'm Dr. Richard Carmona, 17th Surgeon General of the United States and a distinguished professor down at the University of Arizona. I'm the senior advisor to Governor Ducey on public health emergency preparedness. And I'll just take this off so it'll be a little easier to communicate while I'm speaking. I stand here today alongside medical leaders of Arizona's hospitals, both in person and virtually, as you can see behind us, because we need your help. Even with safe, free, and highly effective vaccines available, peaking in mid-August, alongside us to help us in this everyone needs. That is 19 patients. Today, put this pandemic behind Arizonans, that again now, books. And they are 6 months, hospitals need everyone. Everyone, not just for them, to contribute to make work together.
Awesome, thank you, Dr. Carmona. As you stated, vaccination remains our absolute best weapon against the ongoing COVID-19 pandemic. As you've heard from us before, the winter surge is already descending and will be very impactful to our healthcare systems. Our intent is to take care of as many people, both COVID and non-COVID, as we possibly can, and help everybody be as healthy as they can be. What we know is that vaccine prevents disease, hospitalization, need for intensive care, and need to be placed on a ventilator. Vaccine will also keep you healthy and help you not miss out on the upcoming holidays. It's also the most important step to avoid dying from COVID-19. At Banner Health hospitals, 80% of those who are hospitalized with COVID-19 are unvaccinated. Individuals who are unvaccinated will continue to have increased likelihood of being ill with COVID-19, increased likelihood of being hospitalized with COVID-19, increased likelihood of ending up in one of our intensive care units with COVID-19, and increased likelihood of dying from COVID-19. This is largely a preventable disease, and COVID-19 deaths can also be prevented. Please, if you're unvaccinated, get vaccinated now to reduce the likelihood of becoming ill. Our data is trending similar to what is seen across the entire country. The CDC has stated that unvaccinated individuals are about 18 times more likely to be hospitalized and about 14 times more likely to die from COVID. Don't risk missing out on the holidays. We want you to all enjoy the holidays, but do so and get vaccinated ahead of time. I now would like to introduce Dr. Michael White with Valleywise Health.
Thank you, Dr. Bessel. You know, one of the most important populations that we've had and throughout the pandemic that we've not been focused on a lot is our children. You know, we know that children can spread COVID-19 disease, much like we've seen in the adult population. Although we have not seen the rate of hospitalizations in children as we have in adults, we know that they have severe illness and infection that can require hospitalization. We now have availability of vaccine for our children. Those that are ages 5 to 11 are now eligible for vaccination. And I would encourage you, as we are approaching the holiday season, if you've not had an opportunity to get your children vaccinated, to please consider doing so and discussing this with your healthcare provider. We want to be able to facilitate our ability for our children to come together, to preserve our ability to have them in schools, and have them be able to have least disruption as possible in their lives from the pandemic. These tools are available to us today, and we need to continue to avail ourselves from them. I'd now like to turn this over to Dr. Stephanie Jackson of Honor Health. Dr. Jackson?
Thank you, Dr. White. While the initial protection afforded by the COVID vaccines is excellent, it is now clear that this protection fades over time. If you are over the age of 18, and it has been greater than 6 months since your last vaccine dose, now is the time to go and get your booster shot. The boosters are widely available at local pharmacies near you. I cannot stress how important it is for you to get your booster shot to protect yourself, your friends, your family, your loved ones in our community. It will not only decrease the likelihood of you becoming ill with mild to moderate illness, but it will also protect you from the effects of potential long-term COVID. We know now that those who are lucky enough to survive COVID still suffer from long-term effects such as depression, increased rates of heart attack, stroke, and other illnesses such as blood clots. Don't take your chances with this virus. It is a random killer. If you've been lucky enough to avoid illness to date, don't relax now. Take this opportunity to protect yourself by getting a booster dose. The side effects are mild, some minor arm pain or temporary fever that can be managed easily with Advil or Tylenol. There are no additional risks to getting a booster shot. Please, in respect for all of our healthcare workers who continue to fight this virus each day, go and get your booster shot as soon as possible.
Thanks, Dr. Jackson. I'll speak now briefly about the flu vaccine. As we head into the holiday season, my colleague said it very well. All of us want to help all of you and your families to stay as healthy as possible. That's why, in addition to receiving your COVID vaccine, we're recommending that you please consider getting your annual flu shot. While cases of flu in Arizona have been lower in the past 18 months, the numbers seem to be increasing again. On average, each year, about 4,000 Arizonans are hospitalized for serious flu illness. Sadly, about 700 Arizonans die each year from the flu. I myself was hospitalized 12 years ago from serious flu because I was delayed in getting my vaccine and because, honestly, I was a little skeptical about whether the vaccine worked. I was wrong. Here are some facts about the flu vaccine. It does not cause the flu. It protects against multiple strains of flu, and it especially protects against flu for those who may be most vulnerable in our community, for the older, for our younger children, and for those with chronic medical problems. And very importantly, you can get your flu shot at the same time as you get and receive your COVID vaccine. Decreasing the spread of flu in our communities is good news for our hospitals, for our emergency departments, for all of the doctor's offices around the state. It's also great news for us personally, individually, and for our families, and for everyone around us. So if you haven't done so already, please consider getting your flu shot as soon as possible. It may be one of the best gifts you can give to your community and to those you love during this holiday season. Now I'll introduce my good friend and colleague, Dr. Keith Frey from Common Spirit Health. Dr. Frey?
Thank you, Dr. Carroll, and good morning, good afternoon. Well, from your community, our community of healthcare professionals, we want to wish you a most healthy, happy, and safe Thanksgiving and holiday season that will follow. I want to take a few moments and remind us that the current circulating variant of COVID-19 is highly infectious and highly transmissible, even if you're fully vaccinated like myself and my colleagues. So we want to remind you of those mitigation or safety procedures that we've shared with you over the last 20 months as we particularly this week gather as families and friends to enjoy this Thanksgiving season. I know we're all tired of this. It's been a long haul. Wearing a mask, washing our hands, it's out of our ordinary routine, but it is so important right now as we move into this next season where gatherings naturally occur that you follow our recommendations on wearing a mask, whether you're vaccinated or not, maintaining social distancing, great hand hygiene. If at all possible, particularly here in Arizona with our wonderful November weather, eating outside on Thursday would really be a real safe step to take. And if you have any symptoms at all that would suggest you're infected, please, please, please don't attend your gathering or host it. You can have leftover turkey on Friday. It tastes almost as good. So we really implore you to follow these safety measures that are proven scientifically and will help us continue this journey in stamping out this infection in our community. So now I'm going to introduce my colleague, Dr. Alyssa Chapatel from Mayo Clinic.
Good afternoon. I heard a few things that beg repeating. One, COVID remains a public health threat, a serious public health threat. Two, prevention is the best strategy that we have for COVID. Three, vaccination is the most effective therapy that we have for prevention. So what if you do everything you can to not get COVID and then you still get COVID? Are there therapies out there? Yes, there are therapeutics available to treat COVID so you don't end up in the hospital with us. These are known as monoclonal antibodies. And monoclonal antibodies are therapies that research has shown us that prevent people from coming into the hospital, prevent those who end up in the hospital from needing ICU care, and those who receive monoclonal antibodies are less likely to die from COVID. The issue is you need to get tested early to receive these therapies. So if you get sick, please get tested. You need to receive these therapies within a few days, and you need to receive them before you get sick. Monoclonal antibodies work in two ways. They enhance your immune system, so prevent the virus from getting into the cells so they don't cause damage. And they also block replication, so they stop the virus from growing in your body. These are the type of drugs that we use commonly to treat some cancers and arthritis. So again, research has shown that these are proven effective therapies. One thing that's coming down the pike that you may have heard are that there are new PO, meaning oral agents, that may be approved soon. The monoclonal antibodies that I'm talking about right now are only available through healthcare facilities via IV or infusion therapy. Once these oral agents are approved, you may be able to get treated at home. We're very excited about these. But the key is prevention is the best strategy. If you get COVID-19, there are treatments available, and so you need to get tested early and contact your doctors immediately if you test positive. Thank you.
Thanks. And now we'll be joined by Dr. Darlene Melk, who is the Chief Medical Officer of the Chiricahua Community Health Center, and she will provide a Spanish translation and a summary of our remarks.
Buenas tardes. Hoy hemos escuchado de varios directores de hospitales sobre la necesidad crítica de prevenir un aumento de coronavirus durante las vacaciones y cómo aplanar la curva. Arizona necesita capacidad hospitalaria para cuidar a los pacientes que lo necesitan, como para cuidar mujeres durante sus partos, personas que sufren de accidentes o ataques del corazón. Debido al coronavirus y por otras razones, los hospitales están estresados en este momento. Nosotros podemos ayudar a preservar la capacidad hospitalaria al, número 1, vacunarse contra el coronavirus. Es la mejor arma que tenemos contra este virus. Y ahora se puede vacunar a los niños mayores de 5 años. Número 2, obtener su dosis de refuerzo. Todas las personas mayores de 18 años ahora se pueden recibir este refuerzo y es tan importante para seguir esta guerra. Tercera, vacunarse contra la gripa, que se puede poner y administrar con vacunas contra el coronavirus a la misma vez. La gripa, aunque es menos este año, todavía provoca muchas enfermedades y es importante poner esta vacuna. Número 4, seguir las estrategias de mitigación que han demostrado reducir la propagación, incluido uso de mascarillas, el mantenimiento de la distancia física y quedarse en la casa si estás enfermo. Últimamente, si contraen el coronavirus, Es importante hacer la prueba rápida y investigar si es posible recibir el tratamiento de anticuerpos monoclonales para reducir la posibilidad de una enfermedad grave y estar en el hospital. Por favor, ayuda a preservar la capacidad de nuestros preciosos hospitales y ayudar a pelear en esta batalla contra el coronavirus con estos métodos importantes. Muchas gracias.
Doctora Milk, muchas gracias por tu presentación. And now we'll go on and answer any questions that you may have. So, Steve, how would you like to?
Oh, Josh is standing up first.
Okay. I'll let you do the triage.
Dr. Carmona, everyone, thank you for doing this for the public. Dr. Carmona, you used phrases, pleading for help, we are at war, and hospitals are experiencing the crush of unvaccinated patients. I spoke with Dr. Joe Gerald with the University of Arizona this morning. He said vaccines will no longer save Arizona. We're beyond that. It's up to the individual, which I've heard you say, all of you say, take responsibility. Get vaccinated if you can, take safety mitigations. He also said that we could experience 4 to 6 weeks of increases in deaths and cases here, and that the virus could impact hospitals for the next 2 to 5 years seasonally and place burden on them. Your response to that, and where is Governor Ducey?
Well, first let me, I forgot to mention that Don Harrington is with us as well. He's our director of the Arizona Department of Health Services, so we're very fortunate to have a very big team that meets on a regular basis, both from the public and private sector, to deal with these issues, and we're very grateful that they took the time today to be part of this presentation. First of all, Dr. Gerald's a colleague of mine. We sit on the same faculty. We work together, and as you know, I've been for a long time overseeing the incident command system down in Arizona and deal with those numbers. So he's correct. These epidemiologic numbers are ones of great concern, which is one of the reasons why we decided we needed to come together as a team, because we're all in this together, to inspire the public to listen to us as to what needs to be done. The idea that vaccines are no longer important, I would dismiss. Vaccines are extraordinarily important and is one of the main tools we have at this point. It's not going to cure everything. We still need the mitigation strategies and everything else we mentioned today. But clearly, vaccines need to be adhered to. Okay, so I think that the messages from all of my colleagues have been very clear today about what we need to do to go forward. We are concerned because of Dr. Gerald's information, but also the information we see from CDC and NIH and all the others that report. And there's a sense of urgency because people are tired. As you've heard Dr. Fry say, you know, we're all suffering from COVID exhaustion. But now's not the time to take a break. We must work together tirelessly to eradicate this virus. And the only way to do that is to be able to accelerate our herd immunity, and then the virus has no place else to go. We have a history in our country. Back in the 50s and 60s, polio is the perfect example. My mom was afraid to send us to school because kids were in iron lungs. Yet Dr. Sabin and Salk came up with a vaccine, and polio's pretty much eradicated in the world now. And we think about measles and mumps and rubella. These are vaccinatable diseases. Vaccinations, as I said, are probably the most important advancement in science in mankind because populations are not being wiped out as they used to be, but people have to step up and participate. So that's the message for today. Did any of my colleagues want to add something?
Well, I think they're quite happy having you up there.
Okay.
Okay. I would one follow, Howie, if I may.
Yes, sir.
I would follow that with, you know, my question of where is Governor Ducey? I know from conversations you and I have had,
Yes, sir.
and I don't think any of us want this to be politicized. It shouldn't be. It's a matter of public health. We all know this. But it has become very politicized.
Okay.
We look at the mandates. We look at the federal mandate. Even today, 95% of 3.5 million federal employees have adhered to that mandate of being vaccinated. Should there be a mandate? Well, how about this? Will a mandate save lives? Will a mandate save Arizonans? And if not, how do you reconcile, based on the data, that seasonally for the next 2 to 5 years, we're going to have Arizonans that die because of COVID-19?
Good question. So I think it best be framed from, not speaking for my colleagues, but for myself. When the governor asked me to step up and help, we had those discussions. And I said, well, Governor, I'm happy to step up and help my colleagues because it's a team effort. It's not just me. It's Don and Jessica and the whole team at Arizona. And then all of these the chief medical officers meet every week, usually twice a week, many that you see in there. And we share information and best practices. But when I spoke to the governor, I said, I'll be happy to join the team, but I have to know where you stand on these issues, okay? And I'm not going to get involved in the politics as a Surgeon General, as a professor, because that's not productive. People are dying while we're arguing. Yet our state is divided, our nation is divided by all of these issues. We, the team, have decided that we're not going to do that. We're going to stay focused on what's important. That is, deliver the vaccines, deliver the medications, deliver the medication strategies. And the governor said to me, Rich, if you'll do that for me, I will support all the things you're making, the PSAs, groups like this, providing the funding for programs. And I said, okay, that's fine, because this is a compromise solution. Our legislature has thought that they would limit certain things. Some of us might do it a different way, but that's not the issue here. The issue here is we must save the lives. Every one of us are committed to reaching every single Arizonan, to get them the information they need, to inspire them to make the right decisions. I'm not, and I don't think I'm being Pollyannish, if you will, by forgetting that we are a state and a nation that's divided. It's a democracy. And I learned as Surgeon General of the United States that often the most contentious issues are ones about the rights of the individual versus the collective rights of society. And here is one before us. Smoking. There are other issues as well that people say, well, I'm an American. You can't tell me what to do. What we're doing today is pleading with that American that it's not about you. It's about you, your family, your community, our state, the nation, and the world. Because if we cannot achieve herd immunity globally, this virus will continue. So that's the commitment we've made.
I cover the legislature, and I appreciate what you're saying. The legislature had tried to, although they screwed up the way they adopted it, these mandates. But let's talk about, from a public policy standpoint of setting examples. I go to political events. I was at the Republican Governors Association, and all these elected leaders are running around without a mask. You talked about the importance of mitigation. What do you tell the political leaders who are not even bothering to set an example of a proven mitigation strategy?
What we tell everyone, not just elected officials, is to utilize these mitigation strategies, okay? We don't have authority to force anybody to do those things. Again, it's a democracy, and individuals are making some decisions that we may disagree with. But among us, we are all joined at the hip on these issues. And you've heard us in public tell you, it's about the vaccines, it's about mitigation strategies, it's about social distancing, it's about watching transmissibility in your community. So again, we're staying out of the political issues because that's something elected officials are charged with doing. We're staying focused on the patient because irrespective of who's in office, which party prevails, it doesn't change the way we practice. We still are focused on what's good for the health, safety, and security of the community.
Okay. So maybe the question then becomes, how much good could be done by this governor who was off giving off turkeys yesterday, doing other things? How much good could be done by the governor setting an example and wearing a mask?
Well, I think everybody wearing a mask can have some incremental value. But continuing to divide our state and our nation by these issues are counterproductive. And so we have chosen to stay focused on what's important to the patient. Let me tell you something. Every day, these doctors see patients. They don't screen them if they're a Republican or a Democrat or an independent. They take care of a patient. When I was a soldier in combat, and I lost buddies in combat, to this day, I don't know what party they belong to. They were downrange as Americans, okay? So we're doing the right thing for the people and staying out of the politics, which is terrible, quite frankly, that our country is divided on this. That's not our issue today. Our issue is to make sure every single citizen understands what they can do and make a good decision to protect themselves and their family.
But isn't that message being undermined when you have public officials who refused to talk about one thing you talked about, which is to wear a mask. Isn't that message being
Well, I see some public officials wearing masks, and I applaud them for doing that, okay? But again, we don't have the authority to order anybody to do anything. We are leading with the best science available, and you see just about every health system in our state here represented, and we're all telling you the same thing. Practice the mitigation strategies. Get your vaccine, get your boosters. Talk to your primary care doc if you are sick. Monoclonal antibodies, antivirals that are coming out maybe at the end of next month. All of those things. We're driving this with the best information that's nonpartisan. That's our goal. And we're staying out of the political lane because it is non-productive as it relates to the patient. I'm sorry, ma'am, I didn't see you there.
Has Governor Ducey received his booster shot?
I have not spoken to the governor about his own medical record, and as you know, that would be privileged information anyway that I couldn't talk to you about.
And I don't know if Director Harrington could speak to, we've heard so much about hospitals nearing capacity now. Is there any change in strategy as far as using the surge line more or delaying elective surgeries? Are we getting close to that point on anything?
Twice a week, our chief medical officers meet, and those that are online here, to discuss those very issues. How do we handle this? We have a number of smaller groups that are working. As late as yesterday, I was in discussions with the Don Harrington staff at Arizona Department of Health Services around the surge line, what can be done. So there are a number of things that are being done already to assist. Where there's a shortage, especially of nurses, the state has put in an enormous amount of money. What's $120 million, Don, so far, and another $24 million coming up pretty soon?
Close to 180.
$180 million total to bring staff in to help all of our docs who are trying to do the best they can. We are particularly worried because at this time of the year, the snowbirds come in. The holidays, people are coming together. It's colder outside. Those are all actions that can precipitate transmission of disease in people who are not vaccinated. So we understand that. After a year and a half, 2 years, I look at this as we have been in effect in combat for that long, and people are suffering combat exhaustion. Often we don't speak about the mental health issues. The mental health issues are significant. People are just tired. They want to go home, be with their families. Think about the nurse that's in that ICU for a 12-hour shift in PPE, personal protective gear, but then can't go home and hug their kids until she takes a shower or he takes a shower. Think about the immense mental burden of coming in and knowing you're going to lose patients every day in that ICU, just like you're in combat. We understand, and I can tell you that every one of the folks here and our chief medical officers there discuss this every day, and are trying to figure out innovative ways to move this forward. The state has stepped up to provide more money to provide increased nursing. We're finding now that even paying people a little more, it's the holidays. Those nurses want to be home, those technicians, respiratory therapists, so it's tough. But every state is going through this. It's not just us, every state. And we have a team in place under the direction of Don Harrington, the boss at Arizona Department of Health Services, with the approval of the governor, to get these questions answered and do everything we can with the limited resources and increasing demand for those resources.
There's been some discussion before from hospital leaders about
I'm sorry, can you just pull your mask down a little? Thank you.
There's been some discussion before from hospital leaders about having trouble transferring patients, non-COVID patients. Is there any discussion of using the surge line for non-COVID patients?
There is discussion about that because there's moral, ethical, business issues that we're looking at all of the elements in this and getting the learned opinion of everybody that you see online here and right here. It's not an easy decision, but the surge line is being overwhelmed with COVID patients. I think when I spoke to Banner recently, Margie, was it about 80-something patients that you had waiting for transfer?
Actually, we have over 130
Over
this
100,
morning.
so it's gone up. So we're on this. We speak about it at every meeting and trying to figure out innovative ways that everybody has access. We're worried about our rural hospitals, which have a paucity of resources. But again, Don and the team have been working with the rural hospitals to figure out how do we help them, but also not overwhelm our urban hospitals, which are already taxed. So those are an honest appraisal of what's before us, and we're working on it every single day. Yes, ma'am.
Stephanie Innes from the.
Yes, Stan, nice to see you again.
Nice to see you. So I wanted to continue on that discussion about the patients being transferred, and I see Dr. Miller from the Copper Queen Hospital
Yes.
here. And I wanted to ask him, what is the situation with transferring patients from rural hospitals? And then also, Dr. Bessel, if you could just expand on what you talked about with patients waiting to be transferred. I wanted to know, are patients lingering in EDs, waiting for beds? I mean, what's the situation for patients right now?
So we'll get Dr. Miller maybe first, and then Dr. Bessel.
Yeah, good afternoon. Thank you. So I'm the CMO at Copper Queen in Bisbee. We're a 13-bed hospital without an ICU, and we have 24 emergency room beds. Last night, we entered crisis standards of care, shut down the operating room, so it is no longer functioning, so we could redeploy our operating room nurses to our medical surgical unit because it was full. We had critically ill patients there, which we do not, prior to COVID, we did not take care of critically ill patients. We had a CHL, a congestive heart failure patient that needed dialysis, and we had a person working all day trying to transfer the patient inside or outside of the state because he was close to death. And somehow, fortunately, late last night, he was transferred out. And so far, our ventilated patients, which again, other than in the emergency room for stabilization, we're not capable and don't have the staff to manage intensive care patients. So things have improved a little bit this morning, but we still have our operating room closed, and we're gonna just hope things get a little better over the next few days and that we can reopen it on Monday because, well, for example, last Friday, our gastroenterologist told me that she found 2 advanced colon cancers because their colonoscopies have been delayed for months, and now those are getting rebooked into May of next year. And that's what we canceled today, were 17 colonoscopies. So we are having problems down here.
Thank you, Ed, I appreciate it. And Dr. Miller's pointing out something that is a major problem across the country for the last year and a half, that routine care is being delayed across the board because of taking care of the urgency of the COVID patients. And that's not something unique to him, but in a rural hospital, it is a very urgent situation because they have nowhere else to go. So Margie, are you still on? I think there was a question for you. There you are, please.
Yeah, yes, I am. So thank you. We are at Banner Health also working with all of our other healthcare systems, as Dr. Carmona pointed out, and have been doing this for the entire part of the pandemic, working together to be as available as we possibly can for everybody who needs us, both COVID and non-COVID. The purpose of today and our messaging today is to ask for assistance. We need less COVID patients that will allow us to do exactly what Dr. Miller was speaking about, take care of the non-COVID patients as well. There are patients out there that have been delaying their care, that are presenting later in their process of disease, and all of this is causing additional burden onto an already very burdened healthcare system. We're asking everybody to do your part to help us. Our nurses are tired, our physicians are tired, and yet they all want to be there for you, for your family member, for your friend, for your neighbor when you might need our care. So what can you do? We're going to go back to the things that we asked you about and talk to you about today. If you're not vaccinated, get yourself vaccinated. If you haven't gotten your flu vaccine yet, get your flu vaccine. If you haven't been boosted yet, get boosted. If you're sick, stay home, get tested. If you turn out to be COVID positive, get with your physician and find out if you're eligible for treatments such as monoclonal antibody. Every single one of these steps will help create additional room in our hospitals for those that truly need us. One other additional comment about surgeries. Our hospitals every single day are trying to manage the number of patients that need us. That includes those coming through our emergency departments, those that are already in our hospital, and those patients out there that need surgeries and other procedures. That can include colonoscopies, as Dr. Miller spoke about, as well as other medically necessary procedures. The surgeries being performed in hospitals are medically necessary. While some of those surgeries can be put off for a short period of time, they cannot be put off indefinitely. Many patients have already had their surgeries delayed throughout this entire pandemic, and we know that we still have a lot of surge left. We're asking for your help so that those patients too can get the surgeries and the procedures that they need so that they can be as healthy as possible, avoid pain, which many of them are suffering from as they await their surgery, as well as an opportunity to be cured of underlying diseases such as cancer. So please get vaccinated, get boosted, get your flu vaccine. Do not go out when you're ill. If you're ill, get tested. If you get tested positive, get with your physician and see whether you're eligible for monoclonal antibodies. We're doing the absolute best that we can and want to be here for everybody. And yet, as you can tell by the numbers, we're reaching a point where our capacity is being very, very strained. And we need your help to try and reduce the influx of patients coming. 50% of our patients in our ICUs are on ventilators today at Banner Health are COVID positive. If we didn't have those patients, we would have more than enough room for all the other patients that we're talking about that need us today.
Dr. Eller from Abrazos, would you want to make a comment? I think you're on mute. There we go.
So yes, I am the CMO for both Abrazo as well as for Carondelet in Tucson. And I just echo everything that Margie said. In addition, I think it's important that people realize that the reason all the CMOs are getting on calls twice a week at least to talk to one another is so that we can collaborate and share our resources. I think this has been the most effective in terms of helping to balance the load of patients across our systems. I have many times in this pandemic reached out to one of my CMO colleagues so that we could facilitate a transfer of an urgent patient. And it's unprecedented the amount of collaboration that we as different systems, Honor Health, Dignity Health, Banner, all of us, Valleywise, are coming together to collaborate on a regular basis so that we can talk about what resources we have. We talk about strategies that we are implementing in our hospitals so that we can share best practices with one another. And we are actually making sure that we maximize the resources for our community. This in and of itself is probably unprecedented. And one of the benefits, if you will, that came from this pandemic is that we have reached a new level of collaboration. And really what we're asking now is for the community to follow our lead in collaborating with us and collaborating with one another to stop this pandemic. And the strategies that my colleagues have talked about is really the only way to do this. And I agree with Dr. Carmona. We need to put aside politics and really focus on working together. The vaccine is bipartisan. It was actually through the program that President Trump put in place. There was a increased rapidity with which the vaccine was created, and now with President Biden, an increased rapidity with how the vaccine is being distributed. This is a collaborative effort, and we need to keep acting as if it's a collaborative effort rather than a partisan effort.
Dr. Besser, Keith Frey again from Dignity Health. Couldn't agree more. You know, we've spent a lot of time talking about what you can do to protect yourself and your family, and that is so very important. We're just pleading with you to help us because your healthcare system is one of the best in the country. We have terrific doctors, nurses, respiratory therapists, pharmacists show up every day, have decades of experience taking care of Arizonans. This is what we've been called to do. It's a noble profession. We want to take care of everybody, whether in a rural setting or an urban setting. That's our passion. And we have been very elastic as systems working together through this pandemic, through the various surges. We've been able to flex up and flex back. But we're at that point. The law of the rubber band is such that you can stretch a rubber band to a certain point, and then you get to a point where that rubber band can't be stretched anymore. We are letting you know we're very close to that point. Exhausted nurses, exhausted doctors, please help us help you so we can continue to be here for you. That's what we've been called to do, so thank you.
I just wanted to reassure folks that we are all working together. There are 4 tiers to combat this pandemic, and 4 tiers that need to work closely together and that are interdependent. One that you mentioned before was policy, the governor's office. And the governor's office is working with us very closely. We have executive orders, we have a public health emergency, we are receiving vaccines and those monoclonal antibody therapies that we discussed. We have the healthcare system. We have Arizona Department Health Services, ASHA, that works very closely. They're load leveling the hospitals. They're paying attention to the vulnerable population and the rural areas. They're keeping us connected, and we're in close communication with them. The third tier is the healthcare system, and we are communicating. We have each other's phone numbers. We are available 24/7. We're doing everything we can to increase capacity. We're treating COVID patients and non-COVID patients alike. But that fourth tier is the community. It's the public. And we need you to continue to educate yourself, continue to practice those preventative measures that we've talked about. But those 4 tiers have to work together as a system. And we're trying, that's why we're here today, to engage you as well. Those other 3 tiers are working very closely together at all times.
Thank you, doctors. Other question was, let's see, who's up next? I'm sorry. Okay, please, go ahead.
Hi, Dr. Carmona. Nicole Garcia with Fox 10. When you're looking at the COVID data page, data dashboard, and you're looking at hospital capacity, and the current numbers say there's about a little over 100 beds left for ICU across the state, but then you're also looking at the majority of people who are in ICU are non-COVID patients, and that's certainly about a third are COVID patients. Can you talk about these non-COVID patients? Are they the majority there because they put off elective surgeries or care because of COVID and now they're worse? Or is there another cause or phenomenon going on that's causing more people to enter the hospital, ICU, and emergency care system?
Sure, I'll get started, but then, we're fortunate to have a critical care practitioner with us from Mayo who's dealing with this on an every day, so I'll have her step back up in just a moment. But having, run ICUs and critical care myself, there's criteria to get you into the ICU. The stability, your cardiovascular system, or you have a very complex surgery that requires intensive nursing over that time. So there's a whole mix. The challenge is all of us feel that if COVID wasn't here, we could manage, because every year at this time, we see a surge as people come in because it's beautiful here, and you have elderly people, so-called snowbirds, that come, and they come with heart disease and hypertension and medical problems that need care, and some of them end up in an ICU. Usually, we're able to accommodate that. But now it's much more difficult because COVID is taking up much of those beds. So let me get you up to the moment comment, because she's dealing with this every single day.
Again, Lisa Chapatal from Mayo Clinic. Yes, we are seeing patients in our hospitals that have had delayed care. And so those patients are having longer lengths of stay, they have more complications, and they're receiving our full attention. But we also are treating those COVID patients that have long lengths of stay and that are filling up our ICUs, and they're preventing us from taking care of all of the other patients that have needs, medical needs, as Marjorie said, that if we don't attend to them now, then they will become those patients that get delayed care later. And so it's a careful dance. It's incredibly nuanced. And so we're trying to meet those needs by taking care of every patient as an individual. But yes, most certainly there are patients that have delayed needs. One of the things that we have I guess that's good that has come out of this is that we have learned how to take care of patients at home as well that would have traditionally been in our hospital. In our efforts to free up capacity, we have home health that has expanded in our state. We have home hospital that we're rolling out, and there's telemedicine that is being supported by our Arizona Department of Health Services. So lots of therapy out there, lots of collaboration to treat both the COVID and non-COVID patients.
That the majority of COVID patients right now are unvaccinated, so would you say that it's the unvaccinated people who are getting COVID that are really putting the strain on our system?
So the non-vaccinated patients are more likely to end up hospitalized. They're the patients that are ending up in our intensive care units, yes.
Okay. Yes, ma'am, please.
Vaccinated and you've got your booster, you get invited out to a holiday gathering and there are several people, maybe your friends or family, who are unvaccinated. What's your risk level? I'll let you answer that first.
Okay, so the challenge is, and that's why if you listen to our message, when you are among people that you know that have been vaccinated, your family having a Thanksgiving dinner, there's a relative bubble of safety that you've created there. But when you're in a public meeting, at a mall, and maybe your family's with you, but they're all vaccinated, but everybody you encounter may not be, then there's a risk there of transmission. The fact is that even if you're vaccinated, you might get COVID, but it's going to be a mild case most likely. You're not going to end up in the hospital, you're not going to end up in a ventilator, and you're not going to die. Those are reportable cases if they ever happen. So the vaccine, to be clear, it's not saying that you're never going to get the disease. There are some people that still get ill, but it's usually a mild case. And what it does prevent, which is so important, is hospitalization, being on a ventilator, and dying from the disease. That's what's most important.
Maybe the best thing to do for the vaccinated is just avoid those gatherings if you know that.
Well, as we said in our remarks, when you gather in your bubble, you know, your family and everybody's vaccinated, there's a relative degree of safety there. Going outside, you should be wearing a mask then when you're going to be bumping into people that you don't know their vaccination status.
And so what do you say to those people who refuse the vaccine and just say, well, you're vaccinated, why are you so worried? What do you tell those people?
We tell them that if you look at the numbers, okay, every day in our United States, in our state, people are still dying. We're struggling with the capacity. We're having problems with staffing because even if we can find a bed, there's often not a nurse or a doctor to take care of a patient because there's so many. So you've heard the message repeatedly from all of my colleagues. It's not just about you. It's about you helping to protect your family, your community, actually the state, the nation, because we are never going to be able to control this until we achieve that herd immunity that I spoke to and my colleagues have earlier. And so everybody needs to get vaccinated. That's the most important tool we have. And then we talked about mitigation and so on. You have to be careful. If in doubt, you should put a mask on. Stay away from people that you're unsure of. Certainly anybody who's ill, coughing, doesn't feel well, should not go out. And if you're planning to be at an event and you're feeling sick, stay home. Don't take the chance on infecting somebody else. Other comments? Yes, sir.
Dennis Welch,
Yes,
Arizonans
Dan.
family, good to see you.
Yeah, hi, how are you? Nice to see you, Dennis.
Been a little while. You said that you want to try to stay out of the political lane, but is that even possible given the political rhetoric around that? And can you speak to how much that has gotten in the way and put us in the situation that you're at this podium here today?
It's a great question. Again, it's the perils of living in a democracy where people have the right to choose what they want to do. As I said, the example that I had when I was Surgeon General, for instance, was smoking. And smoking is a huge killer of people. Yet, people would tell me, but you can't tell me not to smoke. I'm an American. So, looking back over the years, and I think my colleagues would agree, there's so many issues that become contentious because the right of an individual saying, I want to do this, and society saying, yeah, but it's hurting all of us. So can you not do that, so this hurts. So politics has created challenges, there's no question. But we have decided that's not our lane. Our lane is the patient and to stay focused on the patient. The state is giving us the resources that we need. We are struggling, as you've heard already, not because we don't have the money or the backing of the governor to do this, it's that we're at capacity right now. And we know the cycles. I mean, everybody here will tell you what November, December look like in a non-COVID time. We get a few more ICUs, we get flu season, we can manage that. It's tough to manage now. That's the problem. We can't surge to take care of what we would expect of non-COVID.
Yeah, and you spoke about capacity, but I'm old enough to remember way back at the beginning of this pandemic, there were plans to open up St. Luke's Hospital to add that capacity. That hasn't happened. Has that been a failure on the part?
No, it's a great question. We have talked about opening up other buildings elsewhere. We've talked.
haven't happened.
Well, we've talked about military, okay, and pop-up hospitals, all of that. The problem is, where are the bodies? I mean, if you have a physical space, you need to have a nurse, you need a respiratory therapist, and so on. So you don't have the man or woman power, and maybe you have the space. Believe me, every day this is discussed, looking at every possibility where we can put patients to help out from this real tragedy that's upon us. And Don, would you mind saying a couple of words, our director from the Department of Health Services, just from the state perspective, and how the team came together under your leadership?
Sure. Well, first of all, thank you all for being here today, but most importantly, thanks to all the doctors that are attendance and on virtual with us. Their help and collaboration in this effort is monumental. I think it shows how united we are and how we approach things. Our department works with the doctors, like Dr. Carmona said, every day in different settings, whether it's through clinical kinds of things that we can be involved in, or whether it's in associations and other activities that they're involved in professionally. They're very important to us. We also want to thank the media. Without you getting the word out, we'd be even further behind. All the things that docs have said today, I couldn't agree with more. We are doing everything we can do, and the best thing we can do to keep people out of the hospital is to get them vaccinated. I think that's the upstream effect. The downstream effect is that you don't have people occupying ICU beds, inpatient beds, or EDs, and then that frees up the nurses to be more available. As Dr. Carmona said in the question that was involving additional space, right now it's a highly competitive market for nurses and other healthcare professionals, and having the space isn't always the answer. It's having the bodies to occupy the space. But keeping people out of the hospital will give us bodies to open up more beds and take care of the people that the many doctors here have talked about who are not getting the care they need or delaying the care they need. Again, thank you.
Just in closing now, just one important message. From my heart, from my colleagues, as a Surgeon General and as part of the Arizona team in dealing with this issue, to the public, please help us to help you. And the best way to do is listen to what you heard today on vaccination, mitigation, and so on. We need your help to solve this problem. We can't, even with the best ideas, we can't do it without the public helping us. Thank you all very much.
Thanks for coming, and thanks also to the Arizona Commerce Authority for having us today. We couldn't have done this in our space with the AV.